Hey everybody, my name is Jacob Bostic and I am a gerontological social worker who specializes in working with Native Americans. And today I will be talking about Native Americans, specifically the older population of Native Americans, and how to understand that they are a population at risk and what social workers should do about that. So, first, when talking about populations at risk, there are different aspects that go into play when thinking about that. And the first would be economic status. Unfortunately, many Native Americans live in poverty. According to the American Community Survey, it was a 5 year plan based in 2006 and ended in 2010. They created a survey that presented and showed information that roughly 27.4 people, Native Americans living on reservations, live in poverty, and 15.3% of Native Americans who do not live on reservations live in poverty. Even though this may not seem like a high number, there are more Native Americans living in poverty than any other population, and they are actually followed by African Americans. There have been many Native Americans who leave their reservations and move to cities, to more like highly populated cities. And according to Jacob Zwingo, as well as other authors, they wrote an article called Causes and Disparities in Death Rates Among the American Indian and Native Population. They quoted that the main reason that Native Americans move to cities is that they would rather search for better education, employment, housing, and health opportunities than to stay at the reservation just to fulfill their ancestors' dynasty. The older population, they do not really move to a city as much as the younger generation does. One reason for this is that they are simply afraid to. They know that they've been working their entire life, so they are like barely meeting that living standard that they need. And if they know that if they move, then they will possibly be in a worse situation due to their age. So the second aspect when observing population at risk is the health status. So unfortunately, there are also many Native Americans who are struggling with the opioid epidemic as well as struggling with alcohol addiction. Jacob Zwingo also stated that the mortality rate for Native Americans is higher than whites or the Caucasian population, and at least 6 of the 10 most popular deaths nationwide. This can include heart disease, cancer, diabetes, stroke, suicide, and pneumonia. And one simple reason for this is that Native Americans lack the resources that these other populations have. This is because when they live on the reservations, they some of the reservations have hospitals, but they are for like minor injuries, nothing severe. So when a Native American has a heart disease or diabetes or struggling with depression or having pneumonia, they do not have the medications or the medicine necessary to treat any of that. The next cultural the next cultural aspect for looking at a population at risk is social supports. Native Americans are very family oriented. This also means that their social supports are very family oriented as well. So their social supports are just siblings, parents, grandparents, great grandparents, and there may be some friends, but it is mostly family. And this can be a good thing, but it can also be negative. So Native Americans, they have a very high suicide and depression rates. And one reason for this is that in their communities, Native Americans are so family oriented that that is their social support group, that they do not have therapists or helping professionals that they can really talk to. And they do not want to have that sense of vulnerability with their family because one of their cultural norms or values is that you need to present yourself as a powerful, independent person to your family, not someone who is vulnerable and who actually needs help. The Fourth cultural aspect when looking at populations at risk would be living conditions. Like I said earlier, Native Americans are very family oriented. This also means that when it comes to living conditions, there are many multi generational households. So, according to the book Aging Matters, generational families can be defined as a family with three or more generations alive at the same time who are also typically living in the same household. There there are also many Native Americans who believe in reincarnation after they have passed away. This is more among the older population. They tend to believe this more than the younger population or those who do not live on the reservation anymore. So this also means that these Native Americans have very much respect for those who have died. They handle the bones and the souls of others with very like a lot of caution until the burial. Some Native Americans actually, after burial, they burn where the grave was, and that is to release the soul from the burial site. That way, it can be reincarnated. So, I guess one big question is just how can social workers play a vital role in helping Native Americans, especially in the older population, when you know that they are a population at risk and they are struggling with a variety of different things. So, according to an article called Social Work with Native Americans, social workers are very sympathetic with Native Americans' problems and injustices. However, they lack success in helping these Native Americans due to a lack of understanding of their culture, the retention of stereotyped images, and the use of standard techniques and approaches. So, I have two recommendations for social workers who are helping or who are working in the Native American population. The first recommendation is to simply understand and research and respect the systems, values, and norms of the Native American population. When working with the older population of Native Americans, they hold very much value and they hold very much they hold a lot of value for their norms. So if you try to change any of that or break whatever they are doing, you're going to have a very hard time doing that, and you will not find success in trying to help them. So it is very hard to earn the trust or the credibility or the respect of another's culture if you just simply do not follow their traditions. Another recommendation that I have is that the social worker must be willing to admit that they are going to have limitations. So they need to listen carefully. They need to be less drawn to conclusions, and they need to anticipate being corrected by the Native American culture. This also helps show that Native Americans matter because when a social worker is trying to help them, they may feel like they are being overpowered. And social workers need to empower people, not overwhelm them. So it is very important to understand these norms, to show respect, and to understand that we need to empower Native Americans instead of overwhelm them. Thank you.